So I'm Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. I want to welcome you to our Advocacy and Public Policy webinar today, Navigating Your Care and Treatment, a Medicare Example.
Medicare comes in 4 varieties, and I always find this fascinating because, you know, it's the alphabet, right? And you would think it would be continuous, but let's just break down those parts of the alphabet. Part A is what is known as hospital insurance, right? It's inpatient services. So, right, it's inpatient hospital fees, inpatient factor coverage, but it's also important to remember that the patient is responsible for an inpatient deductible. Okay, so in 2021, for each benefit period, that was, you know, roughly $1,500. Medicare Part B is more your outpatient or your medical insurance, right? And this covers clinical visits, doctors, labs, what have you. This is where factor is covered, right? For home use or or at an infusion center. It is covered under Part B. And we'll revisit that throughout, because it becomes important when you think about the holistic approach to Medicare. In addition, Part B has monthly premiums, okay, which were $148.50 in 2021. It also has copays and it has a deductible. The annual deductible is you know, lower. It's around $203. But it's important to remember that every time I talk about costs, just sort of keep it in the back of your mind, because these costs add up over time, okay? And then you have Part C, which is a Medicare Advantage plan. This is an entirely optional, it's not a required purchase, and we'll go through the differences between these things in a bit. But it is a private plan. What this private plan does, it bundles A, B, and usually Part D, as in dog. And these are private plans that Medicare oversees, so it is private health insurance administering part of Medicare. And these are typically HMOs or PPOs, and the costs vary widely in terms of advantage. Drug coverage, and that's a pretty easy thing to remember, right? These are private plans that, again, contract with Medicare, and they can be standalone or they can be included in an Advantage plan. And these cover the typical drug costs outside of factor after the deductible is met. And these also contain a number of cost share requirements, and these costs also vary by plan type. Why do I mention that? Because everyone says, well, I don't need Part D. I'm like, no, you do, but factor's covered under Part B, and boy. And I'm like, right, but every other medication that you likely take or will likely take, if you're taking heart medication, cholesterol medication, HIV drugs, hepatitis C drugs, those are all covered under Part D. Pain meds are covered under Part D. So when my hair stands up is when someone says, well, I didn't get a Part D plan because I only cared about factor. I'm like, well, you're going to be out of luck when you're trying to get your pain meds, which is when you usually find out that the person doesn't have Part D, as in dog. Next slide, please. Medicare basically comes in 2 varieties, something called original or traditional Medicare, which is what you see here on the left-hand side of your screen, and Medicare Advantage, or Part C, okay? All this is the take home. You can't be in 2 places at once. Either you have original or traditional Medicare, or you have an Advantage plan. You cannot simultaneously have an Advantage plan and traditional Medicare, okay? And included in that original Medicare is only Part A and Part B. To that, you can add Part D for prescription drug coverage. Also to that, you can add a supplemental or a Medigap plan. And this includes, you know, it's a way of paying, because you've all heard of the 80-20, right? Medicare pays 80%, you're responsible for 20%. And then people flip out because they think they have to pay the 20% of their factor costs. But if you have supplemental coverage, you don't have to pay that 20%, right? It acts as a secondary insurer. So you can have all these sort of different parts of Medicare, and knowing fully that you can only be in one place at a time, okay? But it's important to remember that all of these things, your individual choices with respect to how you want to deal with out-of-pocket costs, or how you want to deal with if you travel a lot, if you go out of the country, these are all different terms and conditions that you, the individual, must consider when you're either enrolling in the left-hand side or the right-hand side, traditional or an advantage plan. Okay, and why? It's important to remember that for the original Medicare, right, you're going to need help. You're going to need help paying those out-of-pocket costs, which is why I'm like, well, why didn't you get a Medigap plan, or why didn't you enroll in an advantage plan so you wouldn't be responsible for those 20% costs? Unlike in Part C, where it just kind of bundles everything and you make a single payment, basically, you know, to the insurer.
Marla, thank you so much. This was super informative and helpful. I want to also thank go ahead.
Sorry, before you thank that sponsor, so you'll send out the open enrollment in California 2022 fact sheet, as well as the slide deck, correct?
Correct.
Because there's a lot of really great, it has a link to the handbook. It has all these important dates and deadlines and when things start. It gives you a lot of specifics to California about the Medicare Savings Program and the number of plans offered in your state and what percentage, blah, blah, blah. So
yeah, we'll send that out to everyone who registers.